My name is Dr. Sam Sidney. I'm a fellowship-trained orthopedic surgeon in the Baltimore-Howard County area. I've been in this area for over the past 25 years, associated with a group called Orthopedic Associates of Central Maryland. Sometimes patients come to my office complaining of significant pain in their shoulder, or, if not pain, limited function of their shoulder. When a patient presents with shoulder pain, a correct diagnosis has to be made. This is done by taking a careful history, a physical examination, and sometimes imaging methods that involve X-rays or an MRI. Once a diagnosis is made, a treatment outline is created. This would include physical therapy with home exercises, pain medications, anti-inflammatories, occasionally injections, and time. When all else fails, as a last resort, surgery is recommended. Arthroscopic surgery of the shoulder requires anesthesia, sometimes general anesthesia, sometimes a regional block, which is a local anesthetic instilled into the arm to numb the arm for surgery. I'd like to demonstrate how this is done with the arthroscope using this anatomic model. This is a right shoulder, the collarbone in the front of the shoulder, the biceps muscle in the front of the shoulder, and the side of the shoulder. This is one of the commonly torn muscles, or supraspinatus, that leads to rotator cuff tears. Also, bony spurs can build up, causing impingement or contributing also to rotator cuff tears. Sometimes pain in the front of the shoulder can be caused by damage to that biceps tendon. Also, you can have a lot of scarring that results in reduced range of motion and pain that would necessitate removal of that scar tissue. Puncture holes or portals are created into the shoulder, in the front, as well as the back, and also the side. With these portals, we're able to visualize the tear and assess how large it is, and also how mobile the tear is. By that I mean, can the torn tissue be brought back to where it belongs? Once this is ascertained, we use stitches, or what we call sutures, to fix this muscle back down to the bone. Healing after rotator cuff surgery is a somewhat long, drawn-out process. Depending on the type of tissue, the size of the tear, sometimes the recovery is quick, sometimes it's quite slow. The length of this recovery is determined by the degree of damage to the rotator cuff. Initially is a period of rest where ice, pain management, healing of the portals is allowed. Then passive range of motion. By that I mean a physical therapist will move your arm. And then when we feel the muscle is adequately healed, we would start active assisted range of motion. That means where you help the therapist move the arm, and then comes the final phase of strengthening. The process of early immobilization can be up to 6 weeks, sometimes longer. Then the progressive strengthening, another 6 weeks. Patients continue to improve for up to a year. After successful rotator cuff repair surgery, one can expect relief from pain and near full function of strength and mobility. I'd like to thank you for watching this video. If you have any problems with your shoulder, either myself or any member of my team are here ready to assist you.